I've been doing pediatric care for more than 30 years now. The threat of the loss of Medicaid is one of the largest threats to the children in our country that I've encountered. And, you know, I've seen pediatric AIDS, I've seen a number of epidemics, but this is a huge threat. When I hear Medicaid, the first thought that comes to my mind is children, because 40% of Medicaid recipients are children. Not having access to Medicaid services would be a disaster in this country, and would be a disaster in our Commonwealth, would be a disaster in the city of Boston.
You know, in Massachusetts, we've had great coverage for maternity care for a long time. I can't even remember a time that we didn't have coverage for the poor and vulnerable. But if we didn't, it would be catastrophic if a woman had an adverse pregnancy outcome. Let's say she had a premature delivery and a baby that needed support throughout their life. That family would then be bankrupted. That's not good for anyone. It's not good for our social situation. It's certainly not good for our economy. And I honestly can't imagine what that would look like in Massachusetts.
Politics is politics, and I understand that, but this is something that requires good policy. We rely on the best evidence to do research and to guide our research and to provide the appropriate care for children. We need our politicians to do the same thing for something as critical as access to health services.
We have plenty of experts in women's health that could weigh in, and they need to allow the experts to help weigh in on things that they have no knowledge of and no understanding of when it comes to women's health care.